At Saint Alphonsus Medical Center, Nampa, we are so fortunate to continue the ministry started 100 years ago by our brave and selfless founding sisters. On May 30th, 1917, with no money, no connections, and ultimately no training, the sisters landed in Nampa, Idaho, honoring their call from God. The sisters cared for the sick under the most adverse circumstances, and frequently cared for as many as 14 patients in what was then known as the Little House Hospital. It was a 6-bedroom hospital. Because they wanted to reserve as much space as they could for patients, the sisters lived in a tent for 2.5 years. Dr. Kellogg, the physician here at the Nampa General Hospital, was so pleased with the sisters and their success that he convinced them to launch a fund drive and that the community would support it. After much deliberation, the sisters did launch a fund drive, and it was successful, and they were actually able to erect Mercy Medical Center in 1919. Building on that same success, the Sisters of Mercy opened a School of Nursing in 1920.
You know, I think about the sisters and their just dedication to the people, and they just love the people. And I think that's what it fits my personal mission of service and how do we really try to make things better. And I keep thinking about the sisters and all their sacrifices they made to provide services and have that health and that wellness in the community, and that's really what I love.
We used to have sisters here in the hospital. In fact, we actually had a convent here in the hospital that some of them lived in, and I always enjoyed their dedication, how hard they worked, and just their care for our patients and everybody on the staff. They always, in our board meetings, keep us on track with our mission and our values.
One of the things that was very important to the sisters is that they were very inclusive of people of all faiths throughout the organization, including senior leadership and in the board of directors. So you didn't have to be Catholic to be a leader in their organization, to be on the board of directors, and they wanted a diverse group on their local boards.
I've been here now 32 years at Mercy and now Saint Alphonsus Nampa, and I've made many friends and many people that I've enjoyed working with, and they'd include a lot of people. I can think probably my first stab at medicine out of residency, I wasn't the most experienced person, and my mentor of those years was Sam Summers. I would be on the phone with him about all kinds of things that I didn't understand or what to do, and he was so gracious about always getting on there, and I'd have to sometimes maybe listen to his jokes, but otherwise he would help me through that and actually help me understand medicine and understand what I was doing, and I'm still grateful to this day for that.
We started our first intensive care unit in the basement of the old Mercy Hospital. I remember the day, I'll never forget this as long as I live. It was about 2 days before we were going to move to the new hospital, the old Mercy now. And there was 2 sisters, and they were both coming to Nampa. One was going home, the other one was coming to Nampa, and they had a head-on collision, the 2 sisters. One was killed outright, and the other one was our first intensive care patient in the basement of the old Mercy Hospital. We didn't think that she would survive, but she did. It was a wonderful experience and one of the best lessons to learn from the ground up, because you had to do it. You had to do it yourself. And we didn't have piped in oxygen or suction. I had a wrench on my nurse's station so that whenever I wanted to change the oxygen, I had my wrench, and we changed our oxygen and our suction with the big wrench on my desk. But it was wonderful. It was a wonderful experience.
I think I stayed at St. Al's and Mercy before that for a lot of reasons. I think one was the camaraderie and the friendship I made with a lot of the physicians in the area, and back in the day, we would spend a lot of time in the doctor's lounge and talk about patients and cases and just about our families. And that's part of the reason, just both the medical staff, the nursing staff here, and just the people, all the people that worked at Mercy and St. Al's.
I just like the atmosphere in Nampa, and it seems we had so many friends, and the medical community was very compatible, and many friends outside. And of course, Idaho was new to me, and I loved Idaho. But Nampa and the hospital and all, it just seemed to fit together. I worked very closely with Robert Hay, and we worked all through the decades, both in and out of the profession. And we are the ones that initiated cardiac monitors in the valley. We were the first ones to do that. I think of this as a very small town, you know, between 15 and 20,000 people or something. Well, it's not that way anymore. And so we need this type of thing. But it's hard for me to realize that we are in this position. But we are, and and that's going to carry on, of course.
As time has gone, people want to stay here, and you can walk down the street and actually see many folks that I've either delivered their babies or they're in high school now or in college, and I delivered them years ago. I take care of their grandparents. It's still that family medicine where you take care of the whole family, and I think you see that a lot here, and you don't see that in a lot of the communities.
We are celebrating our 100 years, and we are investing in our next 100 years. I'm very excited to open up this new facility at I-84 in Garrity, and just to see where the community continues to grow and make sure access is that important point, and so being on the freeway and how that area is just growing like crazy.
I think what's important is that we are building on the foundation that was started by the Sisters of Mercy, and it's our obligation to continue to build a foundation for future generations so that they can continue to care for community and for their children and their children's children, and so that the needs of Nampa will still be addressed in the years to come.
The things that haven't changed are what really makes this a great place to work. It's that personal touch. As I round with all the staff, as our leadership rounds with patients, and we sit at the patient's bedside and talk to them about, about their own care, we hear how great the people are. And that's really, I think, what separates us is the people. Our staff we have are amazing. They care for you, and it's just like a family. And we talk about that, is that as you're in our facility, we want to care for you as you would care for your mother, your sister, your daughter. That's the care we want to deliver. And that's the exact same thing as when the sisters came here and started that. They did it because you were part of their family.
It's amazing to me. But you know, there's still something, you can take all of the equipment in the world and all of the instruments to help take care of patients. But the one thing that the nurses and physicians do, I think, is the personal contact that you make with the patient, talking to them and listening to them.
Well, you know, the good Lord has blessed Marcy and I in so many ways, and He truly blessed us by bringing us to Nampa, Idaho, and allowing us to be a part of the Great Mercy organization. So I just want to give a big thank you to the Sisters of Mercy for all the great work that they have done in the community. And a big thank you to Saint Alphonsus for honoring the sisters and continuing on with the great work that the sisters started.
We are carrying on the ministry of Jesus, and we have the opportunity and the ability to care for all of God's sick.
It is still everything in the world to me. If they would hire me, I'd go back tomorrow. I would, in a minute. And I wouldn't care what my capacity would be, bedside nurse. I love nursing. I never went to work unhappy. Never did.
So much has changed in the 100 years since our founding, but what hasn't changed is our commitment to care for our community and to carry on the ministry started by the Sisters of Mercy. We are here today because of the brave and selfless women religious that came before us and made the sacrifices necessary for us to succeed. From the words of Catherine Macaulay, "Put your whole trust in God. He will never see you want for the means to do His work."